Welcome to A Rare Reality, a podcast powered by Jordan's Guardian Angels. I'm Christina Janes, Director of Outreach and Awareness for JGA, and I'm joined today by our Assistant Project Manager, Brittany Cardoza, and by we're so excited to have you, our very exciting guest here, Adele Stuckey, who is, let me get this all right, the Clinical Director and owner of Alexandria Art Therapy, also a board-certified art therapist and licensed professional counselor. We are talking all things art therapy today, and we're so excited. Adele, thank you for being here.
Yeah, thanks for having me.
This will be great. Brittany and I have spent a lot of time talking about this. I know it's a particular passion of hers, and we just want to get down to the nitty gritty for our families, because anything that's different and out there, a lot of our families are willing to try and want to try. So let's start with the basics.
Sure.
Therapy. What can the patient expect, and how do you even get started in this?
Yeah, great questions. So the elevator pitch, if you will, art therapy, it's a mental health profession that is facilitated by trained art therapists. I can speak a little bit more about how to become an art therapist, what that means. Mm-hmm. And essentially we use art making and the creative process in the therapy process. So my favorite way of describing it is that just as you may speak in therapy with a therapist, instead of using words, we can often use the creative process and the imagery as the vehicle for self-expression. That we don't have to sit in front of each other and talk, that there is so much information and so much processing that's accessible for anyone in that art therapy process.
Yeah, definitely.
Yeah.
What does a patient expect when they start art therapy?
Yeah, I think, the way I practice and the way that many art therapists practice is from a client-centered approach. So to expect that the therapist and the client and the family will work in partnership, that the idea is that we can work together to determine what sort of support a client might need, a family might need, and how we can get there together. So a client can expect that it'll be a collaboration, that it's accessible, and that they don't have to have any familiarity or comfort with an art making or creative process. That's part of the job of an art therapist, is to help guide through the entire process so that you don't have to show up and know what you're doing. Trusting that a little bit, it's uncomfortable, and that no one actually has to know what to expect other than we'll be there to help support you.
Mm-hmm. And the thing that I find exciting about art therapy is it can really be tailored even more. And I thought, this could be great for nonverbal populations. This could be great if you're facing a language barrier of some sort. Like, this really does give you the tools to express yourself without having to have that verbal communication that traditional therapy suggests.
Mm-hmm. Absolutely. And, even in thinking about someone who might be coming to therapy, or especially coming to therapy without a known language barrier or communication need, that it's hard talking about feelings. It's hard talking about emotional experiences, stress, things that are challenging in life, especially traumatic experiences or kind of ongoing needs. And so you don't have to have the words to be able to express yourself, work through what's happening, work through the past experiences, that so much exists just within that creative process, within the imagery, that you don't have to know how to put it into words.
Mm-hmm. And I guess that to piggyback off of that, since we're touching on like the nonverbal aspects of that, how do you meet those needs? Because how do you dive into that if you can't have a conversation necessarily? How do you sort of bridge that gap?
Yeah, absolutely. So up front, I think a therapist is going to engage in, let's call it an intake process, meeting a new client, meeting a new family, if the family is involved, with a little bit of background information. So I may know that a client would be coming to me with a processing approach that does not include spoken language. And so I would likely set up an environment in which we have all of these materials available kind of right off the starting point, you know, here's a variety of materials and what might it feel like if I pass them to you and you have the opportunity to create, and let's sit and share the space together and just see what comes out of it.
Mm-hmm.
In many ways, sort of that mirroring process or the showing by doing, that so much can be nonverbal, even in sharing space, virtually or in person, that, you know, therapist and client can kind of work together hand in hand to kind of explore what shows up.
Mm-hmm.
When we talk about different materials, different things that you would use in a session, some of these kids or adults or anybody in between have a sensory need, or you know, what kind of materials are you talking about? Is that tailored to the individual client?
Yes. So to go back to a little bit about what is art therapy in general, first speaking towards training, that as art therapists, it's a master's level clinician. So art therapists have a pretty extensive background in art materials in general, and then also how to use it within the therapeutic process. So we have this theoretical orientation, this background of information, of understanding not only what it feels like to use specific materials, but also how we might use them intentionally to create containment or be mindful about sensory needs, so that a client's not showing up and being sort of overwhelmed or flooded or kind of pushed into maybe a sensory overwhelm experience. So, you know, for example, imagining for yourself the difference between holding a pen and writing on paper or scribbling on paper versus what it might also feel like to have, you know, wet clay in your hand or acrylic or, you know, watercolor paint. Even the differences between imagining those sensations can be a snapshot into how we're mindful of art materials in a therapy session.
Mm-hmm.
Now this
Can we, sorry, Christina.
Go ahead.
I think it would be really interesting if we could talk a little bit about technology in the art therapy space, because this is something that our kids are very familiar with. And I think it's accessible, not only in the fact that it's available to people, but you can take it from place to place if the kids are in the hospital and they can work on their art therapy there with their therapist, and a little bit about how that's emerging.
Yeah. So I will share transparently that I am someone who trained pre-pandemic. So you know, that's not my specialization. And I'm aware that there is an incredible, just an incredible amount of tools that are available now that have really been developed and practiced since, you know, 2020. And absolutely, I think, you know, not only can you imagine to call back to that idea around pen versus clay or pen versus paint, even calling attention to, like, let's say a digital stylus that depending on the pressure you put, it will change the imagery on the digital pad.
Yeah.
That there are ways in which you can play around with the sensory input there. And also accessibility is so important. So, you know, we're meeting via a virtual meeting. We have the ability as therapists and clients to meet with clinicians who are not present in the same room. And that can expand in so many different reasons, right? So even thinking about like medical health needs and logistical challenges, that there are so many different options, I think, now that just didn't exist before.
Yeah.
Mm-hmm.
I mean, it's pretty amazing at this point that maybe not everything, but most everything can be adapted in some capacity to meet the needs of patients and clients who you know, can't be there in person or need to have things done in a different way. I mean, there's a workaround in some way.
Yeah. Or even, you know, or one way that we've developed it in our practice here is that if we're working with a client virtual, we send them an art kit. So this almost this handoff that we have been able to facilitate in our office can be expanded and extended to virtual clients, right? So there's this kind of lovely connection with the art materials that can still show up even when we're not working face to face with a client.
Yeah.
Mm-hmm.
What is it like when you are face to face? Talk our listeners through what does the room feel like? What is the environment set like? What's the whole experience like? Because obviously it's going to change the tone of the whole event.
Right. And speaking about sensory needs as well, that so I'm in my therapy room right now that lights are pretty dim. We have kind of soft textures. I'm sitting at a table versus a desk or, at a couch. We have lots of grounding tools that are available that are pretty common when you think about a therapy space. Being able to notice, what can I use if I'm feeling overstimulated? What can I use if I'm needing to express myself? What kind of art materials are accessible? So in an art therapy setting, in a private practice world, and in lots of other spaces, hospitals, outpatient programs, schools, we all have our own unique tricks and tips in holding space for our clients and having accessibility to materials. So in a private practice setting, it might be something a bit more like what kind of room I'm sitting in, with a table and kind of a softer vibe, if you will. I've also worked in settings like inpatient psychiatric hospitals, in which physical safety was a really significant concern. And so being mindful about the types of materials we're able to bring in, and that you also want to create a safe space within this therapy setting. I have plenty of colleagues who have worked in medical hospitals or medical settings in which, making sure that, materials are one use only, that they come pre-packaged, that there's an ability to source for those types of things as well. So when we imagine this training as an art therapist, it's not only about, well, what does the session content sound like or look like? It's also about all of those logistical elements of what are my clients' needs, what are my setting needs, and how do I source that? How can I facilitate that for my client and their overall wellness?
And it's really on a per person basis.
Yeah, absolutely. Yeah. And so, to speak again to that individual nature, to get to know a client and hear a little bit more about, what's helpful for you. What materials do you like? What materials do you not like? Right. I love using collage for self-expression, and I have plenty of clients who do not ever want to use it. Right. And to honor and respect that we all have our own ways of processing information. And there's an incredible amount of options that the art therapist can help facilitate that for you or in conjunction with you.
Mm-hmm. Yeah, earlier, when we were discussing what we wanted to touch on in the podcast, you touched on the family systems approach. And I think that might be a good thing to discuss with our families about how do you do art therapy collaboratively as a family? What does that look like? Because it's not like traditional family therapy looked like 10 years ago.
Sure, right. So, in a brief description of family systems therapy, the sense is that you're not only working with just this identified client, right? Maybe it's the person who is seeking medical treatment, or they're the person who is experiencing more of the symptoms per se, right? But that you're also working with every single member of the family or whoever can be present, and imagining that the system, the family itself, is its own being, if you will, so that you understand that everybody influences the other, and that you can work with the entire system together to meet the needs of everyone, and perhaps the person who prompted therapy to begin in the first place. So, in art therapy, a really beautiful way to work with families is to literally collaborate together. Maybe they're creating a piece and working on the same page. Perhaps they're creating several pieces on their own that then can work together, or creating their own version of an image, say, creating yourself as an animal. What might that look like? And noticing how all of the animals interact with each other.
Mm-hmm.
And taking it another step further, where are these animals going to live? How might they collaborate together? What if there's, a bunny and some other larger animal? What does that interaction look like? And allowing the family together to use the imagery as a bit more of a safe exploration versus, hey, family member, tell me how you're feeling and describe it with words.
Yeah, right.
Right. That might be a bit much.
Yeah.
Yeah.
Let's work on something together as a group. Yeah. I actually think it's really beautiful, because then you have this tangible family gift, that you can take with you. That's really beautiful. I mean, that's
And revisit it in the home, like we're having a struggle. Let's remember what we talked about in this and expand on it. Just remind ourselves of how we're going to handle it with grace.
Yeah. And I love in art therapy how we can really use that tangible representation, the imagery, the actual art pieces. We can track that along the kind of the start to finish of the therapy process, that in individual and family work, couples work, that we have these starting images and can kind of track how they may change over time. And also, hey, remember this image? This feels very familiar. I wonder if there's a similar experience happening now versus in the past. To be able to look at those, colors, shapes, imagery that might show up in patterns, and we can get really curious about that too.
Yeah. What about age? Is this better for some or better for the masses? I mean, is this something that's really open to everybody? Because it seems like it would be.
Yeah, absolutely. So essentially, I think you could probably argue birth to death, right? With some caveats, of course.
Yeah.
But yeah, so speaking about kind of training and specialization, many art therapists will specialize with a population. So the idea that you can continue learning and developing your clinical practice to best meet the needs of the client. So some clinicians might specialize in working with children and really develop that skill. Perhaps that really is fulfilling work for them. There may be other clinicians who really love that abstract thinking and kind of existential work that might be more present in adult work. And then, other clinicians may kind of generalize to a variety of different age groups. But yeah, so I'm a clinician that specializes in working with adults and perinatal clients. So kind of pregnancy, fertility, postpartum experiences in people. I often get asked if I work with kids when I say that I'm an art therapist, and the answer is actually no. That I've had plenty of experiences in my career working with children, and as I've continued in my process, that is not where my specialization landed.
Yeah. Yeah. And to keep that conversation going, this idea of the perinatal mental health, the self-care. I mean, Brittany, we've talked about this a million ways to Sunday. For our moms specifically, they carry so much with them on a daily basis, and finding the time for self-care, finding that it's okay to have self-care, giving them grace to do that. Speak a little bit about why and how this would play a role in that, because any kind of outlet we can provide them with to see this might be something that would work for you is so valuable.
Absolutely. And sometimes that means that hour a week or hour every other week or even hour a month that you can work one-on-one with a therapist can be so essential in the support system of a parent, especially those that are kind of the primary caregiver or primary parent in the family dynamic. And So with my work with parents, many people who are socialized as women, as mothers, that there is an incredible amount of messaging that we receive around what it means to be good mother, good parent, and that it can be really easy to lose track of our own wellness. That, well, yes, I need to put myself first theoretically, but my kid's not okay. So how do I make sure that I do both? Right? Or my kid needs this thing. I need to make sure they're okay. And then, it's 9 p.m. I'm exhausted. I'm just going to sleep. Right. And so a lot of the work that I do with parents, mothers, families is how can we create a practice that is so small, it's almost impossible not to do, right? It's those 60 seconds of taking a breath. It's, having art materials that are already out that you can just, walk up to a table, do a little scribble and you're done. How can you look at redeveloping that idea of self-care, of wellness, of the creative process so that it actually works in your life, right? It might mean, carrying around a pen that you love and a piece of paper that you can, doodle on while you're in a waiting room or, well, probably not at a stoplight, but you get
We'll pick up lines.
you get what I mean, right?
There you go.
In these spaces where at least to take a moment, stoplights can be a great space to take a breath, right? Or to turn off all the sound or put on something quiet in the background to
That
really look.
car, I'll tell you what, there is 15 minutes a day when you're just by yourself in the car thinking, here's a moment. Here's a moment to breathe. But that's a good reminder. And it's a good reminder to take that, whatever that looks like for you. But to have someone facilitate this, that's
helpful. Right. And that for many of my clients, the conversation is, let's say we're creating a wellness routine for the week ahead. And one of the things I often do is say, like, okay, you're going to write down therapy and then you're going to mark it off, right? Because you already did it. So there's a success and you get to honor that. And that's a big one. You could probably even write it down a few times. That engaging in a therapy process, engaging in a wellness routine for yourself is so, so important. And parents and caregivers really deserve that, are worthy of that, and that helps them continue to show up in a way that is sustainable.
And Adele, if someone wants to reach out and find an art therapist and get involved, how would they go about doing that? Is it something that insurance covers? How do we make this accessible to the people who need it?
Yeah, so to start out, I would say arttherapy.org, the American Art Therapy Association in the US is a good starting point. Our credentialing association, the Art Therapy Credentialing Board, atcb.org, is our US-based credentialing board. That's who kind of checks all of our training, makes sure that we're up to date with all of our credentials and continuing education. It's what classifies us as a credentialed art therapist that is able to practice within a given state or space. And Google is also a really great option too. Insurance is an interesting question and will depend state by state. So for example, in Virginia, our highest credential at this point in time is a board certification. Many states have developed licenses, which changes things a bit when it comes to insurance. And so really I say, depending on where your state is, take a look at the Art Therapy Credentialing Board and the American Art Therapy Association for US-based clients. That will be a great space to start, and then consulting with your insurance provider about what they need to see. Many art therapists like myself also hold a counseling license or a social work license or a family marriage license to help open doors when it comes to insurance-based payment and families that need to utilize those supports.
Yeah,
Mhm.
definitely. Last but not least, why is this your passion? How did you end up here, and
Yeah.
you know, what drives you?
Yeah. I was always a kid who dabbled in art making. And, I think I was just sort of drawn to the creative process as an outlet. I like to kind of joke about the fact that I guess I heard about art therapy in high school.
Mhm.
Someone told me that I very loudly declared that that was what I was going to do. And I did it. So I think it's one of those things that I knew how much art making and the creative process was important in my life. And always felt like pursuing something in which I could kind of be with people, work with them, kind of provide that supportive space felt so important and kind of a calling for myself. And the art therapy process is just so fascinating to me. I think it really speaks to, so many people who talking about feelings is hard. So there are other options. So, I continued on in my training and have been very driven to create a practice and an approach in which art therapy is the main modality for mental health care. That it doesn't need to be adjunctive, it doesn't need to be extra, that we can use the art therapy process as that main source of wellness, mental health care, and it can stand on its own. And so that's sort of my mission in continuing this work.
It's working. I love that. Talking about feelings is hard, so there are other options.
Absolutely. Yeah.
Brittany, anything else you want to finish up with? Or
Just my utmost thanks. This has been so special, and I've been looking forward to it for a long time. I know it's going to be transformative for our families. So thank you for spending time with us.
Yes, thank you so much. And we'll make sure to link all of the associations that you mentioned there so that we have those for our families. I think they're going to love this. And I think it's going to be a really wonderful way for people of all ages to try something different too. So
yeah.
Adele,
Great.
thank you so much. And for
Thank
those
you.
who are listening, if you have not listened to our other podcasts, check them out. They're on Apple, Spotify, and Google, on our website. Also, you can watch these episodes and jordansguardianangels.org. Also on YouTube with translation services. So take a peek there as well. So we will see you next time. Adele, thanks again so much. Brittany, thank you. And thank you to all of you who are out there listening and watching. We'll see you soon.